So culture is a core element in the delivery of healthcare services and influences how patients and families understand experiences and and respond to health interventions at all life stages, including the life years and at end of life. Older patients may have traditional health beliefs. As I said, I'm from the Caribbean, and one of the beliefs is that if you discuss death, like planning for it, getting your funeral arrangements in order, setting up somebody to be your healthcare proxy, or getting setting up a living will, like this is what I want if I go into the hospital, or this is what I don't want when if I go into the hospital, actually brings death on faster, and that is definitely not true. Failure to plan is the worst thing that could happen, because there's no time. Even though this presentation is for older adults, there's no guarantee that you're not going to have any issues or not going to pass away as an older adult. It could happen at any time. So planning for it is the best thing to do, so that your family is not caught off guard, or you're not caught off guard. So those are some of the beliefs that I am aware of. So culture facilitates and impacts patient adherence to treatment. So we recommend interventions, we prescribe medications, and a lot of persons will not take it because of their cultural beliefs. So if that's something that's happening with you, definitely let us know. We may not be aware. It also affects making decisions about healthcare choices, because depending on the hierarchy in your family, maybe only males make decisions about certain issues in the family, or about certain persons in the family, and the females are the ones making the decisions. So also, again, something to let us know. The meaning of illness and rituals, maybe you're more into home remedies and seeing a cultural person, a doctor, or a cultural person that will give you a treatment or cure, is also something that you may be favoring. And while we're giving you medications and you're not taking them, please let us know this, because we're assuming that you're taking the medication, although we're doing reconciliations every time we see you. If you're not taking it, then you're actually doing yourself more harm, because your illness is progressing. But if your belief is that someone else is more adept at caring for you, then also definitely let us know that. And coping, the different ways, different measures, different beliefs about coping with death and dying. Culture determines the roles of the family, who's the head of the household, who makes the decision, sex-related norms, treatments of older adults and children, religion, spirituality, and related rituals, preferred foods. I know some cultures, like right after childbirth, they will not eat anything cold. They'll only eat stuff that's warm or hot. And sometimes in the hospital, the foods that we bring, they do not want it and they will not eat it, but we don't know why. So there's something to discuss with us. Medical choices, use of cultural practices or folk medicine versus Western healthcare and recommendations and treatments. Patients-related healthcare barriers include limited English proficiency, low to no health literacy, and varying levels of being assimilated into the culture that you are. You may not be comfortable, or you may not be accustomed to the cultures. Like if you leave the islands and you come here to the United States, the cultures that you have that are the way things are done here may be not clearly understood by you. That's something to definitely discuss with us. There may be biases about Western healthcare and medications because of stuff that's happened in history, that you may not trust your healthcare provider. If you don't trust your healthcare provider, or if you have a feeling that your healthcare provider is not listening to you and not responding to your concerns, then that's something to discuss with them. And you also have the option of finding another healthcare provider. So don't stay with somebody that you don't think is valuing your input, and not take the medication or not taking the recommendations, because you're hurting yourself. Discuss that with them, and if necessary, move on and select somebody else that is more favorable to listening to you. You may be distrustful of your clinician. You have the inability to navigate the healthcare system. The healthcare system in the United States is very complex. If we send you for a test and you're unable to schedule that test or follow up with a test, that's something we actually want to know. Cultural concepts of distress. So a lot of persons that are in pain may not actually show signs of pain or grimace or cry or something that we expect to see. They may be very stoic and keep it to themselves. We cannot help you if you don't let us know that you're in pain. So when we ask you, definitely also tell us what's happening. And cultural beliefs and taboos, again, about death and dying, about being ill, what foods you should eat. So those are cultural beliefs and taboos. Patient-centered care cannot be provided without an understanding and appreciation of patients' cultural values, beliefs, and practices. Understanding, appreciating, and incorporating patients' beliefs, values, and attitudes prevents stereotypes, biases, facilitates the development and delivery of services, and meet your needs on what matters to you. So when we ask you what matters, we really want to know what matters to you. We don't know everything, so definitely tell us what your preferences are. And you're also educating our students, because we have students that are in clinicals with us that need to find out that all cultures don't do this way. They don't take care of this illness this way. They want this to happen in their lives. This is what's important to them. So you're also educating the next generation of healthcare providers by telling us what is happening. So when you come to the visit and we ask you questions, please tell us. We actually do want to know, and we do care about what is happening with you. And these are my references. Thank you.